Hello, everyone, and welcome to another video with Academic Coaching for World Changers. I am Coach Denise, and you can check out our website that's listed below. Make sure to subscribe, but stay put. We are going to be talking about narrative therapy in this video to help you pass the NCE. So, what is narrative therapy? What comes to mind when we think about this type of therapy? Well, it's when the therapist is helping the client construct a story in their life. For example, siblings might have different stories even though they were raised in the same house. So they have different perspectives, different ideas of what was going on, and that might cause different things to happen in their life. They tell themselves different things. They have different beliefs about themselves. And this could cause some problems if the way that they see things differently is seeing themselves as a problem, or if they had a traumatic experience in their childhood or anything along those lines. It's that story that they're telling themselves over and over and over again. And the therapist is helping them construct a healthier story for them moving forward. So, some techniques that are used are questions, clarifications. So, the therapist can ask questions, clarify what is going on for the client. So, that's constructing the story together in session, and so that the therapist can understand the client and their story. And then externalize or deconstruct. And so that's separating the client from their story, separating them from the quote problem. So they are not the problem. The story and something else is the problem. And then you help them re-author or rewrite their story. So you focus on their strengths. You write that new story in their life and how they want their life to be. But this is an ongoing process, and it can take some time. So, Dr. Pam has a wonderful metaphor for thinking about how to deconstruct and really understand and reauthor that story of the client. So, think of a cassette tape. There's a picture one right here, just in case you are young and don't know what a cassette tape is. But here's a cassette tape. So, you visualize this tape. Think about this picture. So the client will externalize that story that they have or take out that tape. So think about like ejecting the tape from their brain. Give it a name. Imagine it is not a part of them. They are holding on to this story that has been in their head, but now it's this cassette tape in their hand. Imagine it's not part of them. And then we clarify. So the therapist can ask questions, clarification. So you pull those strings out, just like in this picture. You pull all the strings apart and you are deconstructing that story. And then you work together to reauthor or rewrite a new story. So putting all the strings back into a new tape and putting a new tape into their head to focus on their strengths. They are not the problem. So some other key components of narrative therapy, just to summarize what we have been talking about. So the client's lives are stories in progress. You collaborate as the therapist and the client to get that language right in their story. You change it and you construct a new story. So they will externalize depression, for example, from themselves. They are not the problem. The client is not the problem, and helping them see that and helping them see their strengths and how they can reauthor a new story. So let's try it out. I got a couple practice questions for you guys. So here's the first one. All of the following are common techniques in narrative therapy except, okay, we got A, the exception question. B, deconstruction, C, reauthoring, or D, writing letters? So take a second, think about this, pause the video if you need to. The answer is A, the exception question. This is a technique that is used mainly in solution-focused brief therapy, which we do have a video on. So check that one out after this if you got this wrong, or even if you got it right, still check out that video because it's a good one. Okay, let's try one more. So when the client sees that they are the problem in the story, then they can deconstruct and reauthor a new one. Is this A, true, or B, false? Take a second. False. When they see they are not the problem, then they can start to deconstruct it, reauthor, and make a new story. So thank you for watching this video. Make sure to subscribe to our channel because we are always putting out new ones. Give us suggestions. What do you want to see? I can make so many other videos. So give me your suggestions. What do you guys need help with? What can I make a video on? If you want to book some sessions, you can check out our website, academiccoachingforworldchangers.com. If you want to book with me personally, you can email me at coachdeniseacwc@gmail.com. But I hope you all enjoyed this video and you are going to pass that test.